Question number 1. What is the primary electrolyte involved in maintaining cardiac action potential? The correct answer is option B, potassium. Question number 2. How does the renin-angiotensin-aldosterone system RAAS affect blood pressure? The correct answer is option B, increases blood pressure. Question number 3. Which nursing intervention is essential for a patient with acute respiratory distress syndrome ARDS? The correct answer is option B, provide high flow oxygen therapy. Question number 4. Why is hand hygiene considered the most effective infection control measure in hospitals? The correct answer is option A, it reduces bacterial colonization. Question number 5. What is the most common site for pressure ulcer in bedridden patient? The correct answer is option A, sacrum. Question number 6. How often should intravenous IV lines be changed to reduce infection risk? The correct answer is option B, every 72 to 96 hours. Question number 7. Which hormone is secreted by the posterior pituitary gland? The correct answer is option B, oxytocin. Question number 8. What is the best position for a patient with congestive heart failure CHF to improve breathing? The correct answer is option B, high Fowler's. Question number 9. Why is monitoring urine output crucial in critically ill patients? The correct answer is option A, to assess kidney function. Question number 10. Which vitamin is essential for coagulation and clotting factor synthesis? The correct answer is option C, vitamin K. Question number 11. How does hyperkalemia affect cardiac function? The correct answer is option A, causes bradycardia and arrhythmias. Question number 12. What is the first action when a patient experiences an anaphylactic reaction? The correct answer is option B, give epinephrine immediately. Question number 13. Which nursing assessment indicates proper placement of a nasogastric NG tube? The correct answer is option A, aspiration of gastric contents and pH 5. Question number 14. What is the normal range of hemoglobin in adult females? The correct answer is option A, 12 to 16 gram per deciliter. Question number 15. How often should vital sign be monitored in a patient receiving blood transfusion initially? The correct answer is option A, every 15 minutes. Question number 16. Why is deep vein thrombosis DVT prophylaxis important in post-operative patients? The correct answer is option A, to prevent pulmonary embolism. Question number 17. What is the primary cause of hypovolemic shock? The correct answer is option A, severe fluid loss. Question number 18. Which nursing action helps prevent catheter-associated urinary tract infection CAUTI? The correct answer is option A. Keep the catheter closed and maintain aseptic technique. Question number 19. How does corticosteroid therapy affect blood glucose levels? The correct answer is option B. Raises glucose levels. Question number 20. What is the first sign of hypoxia in a patient? The correct answer is option B. Tachypnea. Question number 21. Which electrolyte imbalance is most common in patients with chronic kidney disease (CKD)? The correct answer is option A. Hyperkalemia. Question number 22. How does positive pressure ventilation support patients with respiratory failure? The correct answer is option B. Improve oxygenation and ventilation. Question number 23. What is the recommended rate of IV fluid administration in hypovolemic shock? The correct answer is option A. Rapid bolus of isotonic fluids. Question number 24. Why is patient education important before administering a new medication? The correct answer is option A. To ensure compliance and safety. Question number 25. Which intervention is priority for a patient with pulmonary edema? The correct answer is option A. Administer diuretic and oxygen therapy. Question number 26. What is the primary purpose of using a pulse oximeter in the critical care? The correct answer is option B. Assess oxygen saturation. Question number 27. How does dehydration affect the hematocrit level? The correct answer is option B. Increases hematocrit. Question number 28. Which type of isolation is required for a patient with tuberculosis? The correct answer is option B. Airborne isolation. Question number 29. Why is it important to monitor serum creatinine in patients on nephrotoxic drugs? The correct answer is option A. To detect kidney injury early. Question number 30. What is the most common complication of immobility in hospitalized patient? The correct answer is option C. Pressure ulcer. Question number 31. How does hypernatremia affect the nervous system? The correct answer is option B. Causes confusion and seizures. Question number 32. Which nursing action is priority when a patient develops a sudden chest pain? The correct answer is option A. Call for immediate medical assistance. Question number 33. What is the main purpose of administering a beta blocker in heart failure? The correct answer is option A. Reduce cardiac workload. Question number 34. Why is proper positioning important for a patient with a tracheostomy? The correct answer is option A. To prevent aspiration and maintain airway patency. Question number 35. Which laboratory value indicates an increased risk of bleeding? The correct answer is option C. INR3. Question number 36. What is the first step in performing cardiopulmonary resuscitation CPR on an adult? The correct answer is option C, cheek responsiveness and breathing. Question number 37. How often should oral care be provided to intubated patients? The correct answer is option B, every 4 hours. Question number 38. Which electrolyte imbalance is associated with muscle cramps and tetany? The correct answer is option B, hypocalcemia. Question number 39. What is the recommended action for a patient experiencing hypoglycemia? The correct answer is option A, provide oral glucose or IV dextrose. Question number 40. Why is vaccination important in healthcare workers? The correct answer is option C, to prevent the spread of infectious diseases. Question number 41. How does a high protein diet help patients with burns? The correct answer is option C, promotes wound healing and tissue repair. Question number 42. Which clinical sign indicates hypovolemic shock? The correct answer is option C, tachycardia and hypotension. Question number 43. What is the main purpose of using incentive spirometry post-operatively? The correct answer is option B, prevent atelectasis and improve lung expansion. Question number 44. Which nursing action is essential for a patient receiving chemotherapy? The correct answer is option C, monitor for neutropenia and infection. Question number 45. How does continuous positive airway pressure help patients with obstructive sleep apnea? The correct answer is option B, keeps airway open during sleep. Question number 46. Why is early mobilization important in post-operative patients? The correct answer is option B, prevents DVT, pneumonia, and muscle atrophy. Question number 47. What is the first sign of sepsis in a hospitalized patient? The correct answer is option A, fever or hypothermia and tachycardia. Question number 48. Which intervention reduces the risk of ventilator-associated pneumonia, VAP? The correct answer is option A, elevate the head of bed 30 to 45 degrees. Question number 49. How is pain-based assist in non-verbal patients? The correct answer is option A, using behavioral pain scales and vital signs. Question number 50. Which laboratory test is most important to monitor in patients receiving heparin therapy? The correct answer is option C, APTT, activated partial thromboplastin time.